Lower back pain. So lower back pain is something we see every day in clinic, and I'm sure all physios, health professionals probably around the world will see people with back pain. The back's made up of three different areas. We'll talk briefly about it, and I'll try and summarise a huge topic in a minute or so. We've got the 7 cervical vertebrae in the neck, the 12 thoracic vertebrae in the mid-back, and the 5 lumbar vertebrae in the lower back, or the lumbar spine. And the lumbar spine, lower back pain, is something probably within the top 2 of the most common conditions we'll see in pure physiotherapy every day. Now, the spine itself, I should take this down, is made up of discs at the front, which sit between the vertebral bodies. The vertebrae run up at the side here. You've got the nerves that travel at the side. They're not yellow in real life, but they are on this model. And the nerves then join together to make peripheral nerves. So, for example, a sciatic nerve is made up of several nerve roots, L4, L5 and S1. We call them L meaning lumbar 5, lumbar 4, etc. and S1 being sacral, the sacral vertebra down here, sacral 1. So these 3 nerve roots become the sciatic nerve, and it travels through the notch here and travels down the back of the leg. It's called the greater sciatic notch. So low back pain can cause lots of different things. Irritation to the discs, irritation to the ligaments, which are structures that stabilise the joints, of which there's many around the spine. Irritation to the muscles, again there's many muscles around the spine that involve instability, for example multifidus, transverse abdominis, and also more in powerful movements such as quadratus lumborum. There's many muscles, all of which could give pain. There's also the nerves themselves that travel, as I say, down the leg, whether it's the sciatic nerve or the femoral nerve, which is often missed, which is slightly higher up in the spine. So you've got the sciatic nerve L4, 5 and S1 originates. Femoral nerve L2, 3 and 4, and that travels down the front of the thigh in towards the knee. Often misdiagnosed as being quads pulls or pain in the front of the thigh, when actually it's a neural referral from the back. So all these different pain-sensitive structures could give pain. What we do know from repeated research is the more active you are, the more you keep moving and bending the spine, straightening the spine. What the spine is sort of designed, meant to do, the more that you do that, the better it is for the spine. The more we avoid doing activity, the more we avoid even lifting things. The idea that we should keep our back straight when we lift, that's largely been thrown out now. Research shows actually, if you're lifting ridiculously heavy weights with the back bent or straight, it's not good. But if you progressively start with lighter things and progressively build up, then there's no harm at all having the back bent when you bend. If you watch a toddler, they'll do what they need to do to lift something up. They won't think, I'll keep my back rigid and just use my knees. That's not a natural thing to do. Movement, regular activity is absolutely critical for the health of the spine to prevent back problems. That being said, most people at some point in life will get some back pain. In nearly all cases, absolutely nothing to worry about. A very small minority require treatment at all, through physiotherapy, for example, and even a smaller minority require anything surgical. So one of the roles I've done for the past 15 years is working in orthopaedic triage type environments where I'm seeing patients that are being considered for surgical interventions such as discectomies. Now this model here has a bulge of a disc here, which is maybe indicated by this red structure, irritating potentially the nerve. Now this is a very basic description of what may happen. Discs don't push in and out, but sometimes they can get a bulge or a prolapse or a compression to a nerve or an irritation to a nerve. Even in those cases, the vast majority of times, after 18 months or less, the bulge will become calmed down, the nerve will tolerate it, and there'll be no symptoms at all, or very minimal symptoms. In some small amounts of cases, that nerve can be so irritated it requires surgical decompression, which essentially you take away part of the disc through surgery. This is done less now because we know that over time, generally speaking, most things settle. If they don't, then surgery is still a good option in a very small minority of cases. But the vast majority, if you have back pain, keep active, keep the area moving. To avoid it, same principles, keep active, keep the area moving. Don't avoid strength work as well. So good research now showing actually improving the strength of the back, not just mobility and stretching, but actual strength work. So gym-based work, resistance work, bodyweight activities, all shown to improve the strength and improve the resilience of the back. Lots and lots of information on back pain on the site. If you've got questions, it's definitely worth having a chat with a GP or physiotherapist, because there's many things you can do to avoid back pain and many things you can do to improve back pain.